we have a special guest who just walked in. I would like to welcome Representative Michelle and Grisham.
Very nice of you to recognize me as I came in. I just flew in from Nevada, talking with retirees about a variety of federal issues, and I really appreciate that you gave me the opportunity to be here tonight to thank you for city-county leadership, both County Commissioner Debbie O'Malley and Councilor Pena. It's really important to bring your colleagues together, I think, and have folks share their feelings about these horrific tragedies, but also to put in perspective that the right response today is to have an action in place that creates the kind of environment where all of our families and our children are safe and productive. And you know, I spend, and we talk about this all the time, more moments than I really care to talk about on the floor of the House and the House chambers before we start not just one session a day, but often 2 sessions a day. We do a moment of silence, and a delegation is at the front of the chambers, and bipartisan, they ask for people's moments of silence and prayers so that we can give our own personal quiet condolences and offer the body's sympathies for all the gun violence and tragic, unnecessary violence in this country. In response to that, I talk all the time about the constitutional right for each of us to feel safe in our own homes and communities. And after the tragedy this week, and then related 2 more deaths of children, my 31-year-old daughter, and I mentioned this to the mayor at the birthday party and vigil, my 31-year-old daughter, who's been married 4 years, who left New Mexico like so many young people did because she couldn't find work here. She's an engineer. And she left to Ohio, and she made her way to Arizona, and she made her way back here because she wants to be here. And she held her baby really close, called me up and said, "I'm moving because I can't be in a state or a community that I don't think is working to address these problems. And if I don't feel that my child is safe, then I can't live here." Well, that shook me to my core in a whole different way. And so I just want to remind us about what's at stake. We're 49th in child well-being. We are 49th in food insecurity. We're 46th in teen pregnancy. I could do a whole bunch more. I think we're 49th in children living in persistent poverty. We are 46th or 45th or 47th. I can look at my notes, but I think I'm making the point that we, single heads of household, and women, and of these single heads of household, these women are often the victims, as Senator Lopez was talking about, of domestic violence. So we cannot allow the perpetuation in our state, our cities, and our communities and neighborhoods where our children aren't safe and our families aren't safe and there's no hope for moving out. So I'm really here to tell you that my job is to listen. I will have staff here all night. We will stay. I'll stay as long as I can. We will leverage every idea, every opportunity for a federal grant to get here, to leverage the county's money for behavioral health, to really work on maybe a new, renewed partnership between law enforcement and schools. I mean, we've got a 29% turnover rate in the social workers at CYFD and at Agent for Adult Protective Services. The eyes and ears of the folks who help us create an environment where we know who's really at risk and how we might touch those families immediately, they're gone. And so without you tonight stepping up and determining that there must be more that we can do, that if this isn't the right call to action, my God, nothing is, because we've been 49th for more than just now in child well-being. Not new. I sit on the Agriculture Committee, and every single time I have a hearing, I get to start the hearing with, we're one of the hungriest states in the nation. In the wealthiest country in the world, I represent a district and a state where I know every single night children, poor people, disabled adults, and seniors go to bed hungry. I know every single night that we have another person who's fallen victim to homelessness. I know every single day that somebody in this community has been affected by local crime and violence. On the way over, I was sharing with Liz Ham, who works with me now, no stranger to county work and public service. Now, I think I've had 4 property crimes, and my fiance just had another huge property crime this morning. I mentioned to the mayor that there's a statistic that he's looking at that says that we're the 5th most dangerous city in the United States.
That's right.
And I think the issue is not what statistic says what, but the reality is that there's a climate here where we have a responsibility to do better. So here's another idea. In addition to leveraging federal grants, you've got that. This community has me. That's my job. You give me the ideas, we will do everything in our power to leverage every dollar, every idea. Every minute.
Yeah.
Yeah. 2. If there's going to be a task force, let's make this a task force really clear about action items and timelines to make a difference. And let's make sure that we're including real experts. And as grateful as I am to be an elected official, I'm not a child welfare expert. So we need folks who really understand this. And 3, when I was at the Department of Health, and then I will sit down. When I was at the Department of Health, there was an incredible doctor. His name is Ron Voorhees. I think he's an infectious doc by training and by much of his career, but he has an incredible public health experience and expertise in our state, and he left for a while too. And he's back. He's at the Department of Health. And in about 2005, he gave me an idea. It's a very simple idea when you look at it, but will take some real leadership to put it together. He called this concept Kids First. It's really looking at the epidemiology of how we treat crisis. And we treat it in the moment that it's the problem, right? And even when we had more engagement in terms of programs and funds for at-risk families by looking at their socioeconomic status, and we did, infant mental health, and we did lots of home visiting, and I can show you, and so can every other public health person in the state, the incredible outcomes of that. But the problem is that we touch a family during that birth, and those 1 or 2 months, and then we walk away. And then we're back when there's the first domestic violence incident and arrest. And then we walk away. And then we're back for the first drug abuse incident. And then we walk away. And then we're back for the first truancy incident. And then we walk away. And then we're back in for juvenile justice touches for this very same family. Generation after generation after generation. And if we stuck with these families at the time of these births, until these kids were 18, you eradicate homelessness, drug abuse, alcoholism, criminal activity, teen pregnancy. You give me a negative public health outcome, which is plaguing our state, and it gets addressed. Why wouldn't we embrace changing a generation and resolving these issues for my granddaughters and yours, and our children, and our families, and our neighbors? And I would really beseech you in this sort of task force environment to reach out to docs like Dr. Ron Voorhees and others. And let's renew at a start that data from that Kids First analysis. And let's talk about making a difference in our toughest neighborhoods and our communities right here at home. Let's put New Mexico families first. Amen. Thank you very much for having me.
I just want to thank you for being here and taking time out of your busy schedule to be here. I really appreciate it. I've always admired your tenacity, and I know that social issues are close to your heart. From the communities we come from, we have a long history here in New Mexico, and our families are large enough to know that we know someone, and I'm sure, I shouldn't make assumptions, but I'm sure everyone here has had somebody who has had behavioral health issues or substance abuse issues, and I think it's time that we come together as a community to make change, so thank you.
So thank you guys for having this meeting. Thank you.